Greetings, everyone. Welcome to the 206th session of the online Optom Learning Series, OOLS. And for today's session, we have with us Dr. PremNandhini. Dr. PremNandhini is a scientist at the Brian Holden Institute of Optometry and Vision Science. She received a bachelor's degree in optometry from the Elite School of Optometry and then went ahead and completed her MS as well as her PhD in Vision Science from the Ohio State University in USA. She also did her postdoctoral fellowship in the field of vision rehabilitation. Her areas of interest are in binocular vision, vision therapy, and orthoptics. And currently, her research work focuses on the areas of measuring visual function as well as functional vision testing. With all this expertise, she is also involved in teaching, published various papers, presented her research work in national and international conferences. And when we reached out to her on, doing a session for us, she's like, we'll do something different. And today she's going to take us through a little bit of a journey on how we look at ethics in optometry in terms of learning, clinics, teaching, and research. So welcome, ma'am, onto our platform. And, let me just leave the screen time to you.
All right. Thank you so much, Fakhruddin, for that very kind introduction and also accommodating a topic that is really offbeat. And honestly, I was thinking how many people will actually attend this talk because this is not your hardcore optometry. So first of all, thanks for agreeing to allowing me to talk on this topic. There is no financial disclosure that is relevant to this topic that I'll be presenting today. And as I mentioned, that I really want to acknowledge Team OOLS for giving me the opportunity to engage with you on this topic. And I also have to acknowledge that I've used quite a bit of images in my presentation, and these are images that you can Google and find it for yourself. All right, so the word ethics is actually a very loaded word, and it could mean different things for different people. And when Fakhruddin Barodawala actually contacted me to give a talk, I think I was in a mind frame of thinking, what is it that I have to really, talk about? I looked at their list of the earlier presentations and very thorough list of all the topics that is of hardcore interest for optometrists. So it's the hard skills, the techniques, how do we work, and all of that was listed. What I in general felt that was missing when I was a student or as a clinician or even as a teacher and a researcher, I think nobody really teaches us the soft skills. And increasingly, there were things that, there are several meetings, there are too many online meetings, and then there are too many optometry colleges, and there are so many students. At LV Prasad Eye Institute, we also take in quite a bit of students for their internship. And I see a very mixed crowd, and we now have our own optometry program also. And the students that come from all these different backgrounds, I always find that it's a very mixed bag of people, very different upbringing, culture in which they grow up. And nobody really talks about, these important concepts of ethics, values, integrity. So the word itself could mean different things for different people. I pulled up, as I said, from Google. And these are all sort of like the, I'm not sure if I should say synonyms, but these are all the words associated with the word ethics itself. And I thought, especially for a profession like optometry, it's very important that we all fall on the same page. And one of the reasons for this is sometimes, there is this conflict that goes on between different professions. And in our profession, we always have this conflict, which is, there is these ophthalmologists, and then there are people who actually wanted to be medical doctors, but they ended up in optometry. So they sort of think they want to be ophthalmologists. And then there is a little tift between the way we practice, especially in countries like US, there is quite a bit of, an acrimonious relationship. I don't think it's as much in India, but nevertheless, there is always this sort of like this Cold War, so to say. And then there are all these, regulations and legalization for the profession itself. And unfortunately, we are still not a regulated profession in India, which means that there are few things that you could do, and neither is it legally correct nor is it illegal, because there are no laws that governs this. So I think, therefore, as a profession for all of us as optometrists, regardless of where you are, and in practicing either in India or outside of India, I think it's important that we all sort of form this real ethics based practice, and that's why I thought I should perhaps just talk about this, because many a times in my class when I teach, I sort of keep insisting on ethics, values, integrity, and all of this. I actually like this quote. I'm not sure who told this, if it was Dalai Lama, but this is the picture I got that says, wrong is wrong, even if everyone is doing it, and right is right, even if no one is doing it. And I think sometimes in our profession, whether you're in a hospital based setting or a private clinic, certain things, sometimes we know that it's not the right thing, but then we do it because we say that, oh, everybody does it that way, or that's how the system works. So I think it's very important for us to pull out that moral fiber and question ourselves on where we fall in these practices. So therefore, I thought, and by the way, this was a very hard topic for me to actually form slides, because I've never given a talk like this prior, maybe except perhaps in research. So I really had to sort of like work quite a bit to see what is it that I want to convince through this talk. And I thought I'll probably take up my own journey as a optometry student till where I am right now, and what are all the sort of like things that I learned in my process of where I am right now. And so I just split this into 4 topics essentially, as learning, clinics, teaching, and research. And by no means am I like absolutely perfect. I'm not saying I'm a very ethical person and all of that. I always think that as children, when we grow up, maybe till our schooling, till 12th grade, probably our parents made all the choices for us, and we probably would have done certain things that is not correct, but then, you just grow up. I think once when we get into college, and from there on, what profession you want to do, where do you want to work, all of that is under much better control as individual people. And therefore, if somebody is making unknowingly doing something wrong, then I think they have to be held accountable depending on which stage in their life they are. So it's a very, very dicey, as I said, a loaded term, very gray zone. But I'll just give few examples of these 4 topics. And honestly, I'm hoping I'll not drag this talk for a long time, but I would really like to hear feedback from participants, just to see, if they have come across a situation, how would they handle it, or even as a bigger profession, is there more that we can do for this? So the learning from my perspective as a student is something I'll touch upon, and then I'll probably touch upon some general concepts in this. And then in the clinics as an optometrist, so we all, join optometry, we are an optometry student, then we go observe in the clinic as observers, then we transition into an intern, and then most of us would end up working as an optometrist, regardless of whether you have your private practice or in a hospital-based setup, or maybe even in an industry, but you're doing clinical trials and all of that. And then some of you probably, I think the poll that was conducted earlier seems like there is a mix of all groups of people. And if you are in an academic or in a hospital setup for that matter, you probably would have been a teacher. And then what's the ethics there when we teach? And as a researcher. Now, the reason why for the researcher I put IRB and Declaration of Helsinki is all because I think research, when we say ethics, it's very closely and easily associated with research, and there are guidelines for it. There is a process, in fact, to see whether you're doing an ethical research. So the role of a researcher and the context of ethics is very tightly linked, and it's much more clearer. But then the other 3 topics that I've listed, I don't think I can put or see any guidelines per se. Maybe somebody could say, as a clinician, especially say, for example, medical doctors, they probably have the Hippocratic Oath, and that's their ethical code of conduct of how they would do. And as optometrists, in some colleges, there might be an optometric oath that they would take, and invariably the first point over there will say that I will not use any drugs or eye drops or invasive procedure. At least in India, that is what we take as an oath. So it's more of the you cannot do rather than what can you do. So I don't think the ethics is very well defined for us. So that's the purpose of the talk today, that I just want to touch upon these topics. These are, as I said, very gray zone, and there is no right or wrong, but I'm just going to give few of my own examples just to say the way I understood. So this is the 4 outlined topics, and we'll just get into what's the ethics in the learning. So usually when we say learning, we are going to put ourselves as a student. And in that position, I'm not going to say these things, okay? Because when I joined as a student, I thought as a student, my responsibility was to study well, to be ethical in terms of I should not be copying from others. I should be sincere. I shouldn't avoid something and give very lame excuses, okay? So I'm not touching any of this. I think this is something that I don't have to give the gyan. You guys are already adult enough, and I'm sure you have, you can master this for yourself. Okay, so the talk is not about these things when it comes to ethics of learning. Okay, I'm just going to divert a little bit here. Exactly last Sunday, I don't know how many of you saw the Google Doodle. It had this picture. Okay, this was 1 week back on 18th June. Google put this doodle. And I'll be surprised if some of you recognize this lady, because I didn't recognize, at least. Maybe some of you do. But then I was just curious to see, usually when Google Doodle puts out images, I want to know who is that person. So it turns out this is Dr. Kamala Sohoni. She is the first woman PhD holder in sciences in India in the year 1939. Okay. And Google Doodle put this out because last week was her 112th birthday. Okay. And so I was interested to find out, like, what is it, how it must have been for her to have been the first PhD woman scientist in India. So if you actually Google and search about her in the Wikipedia page, you will actually see that her name is associated with this person. Now, everybody knows this person. This is Professor C.V. Raman. He's a Nobel laureate and all of that. So it turns out that when Kamala, after she got her PhD, she got a research fellowship and she wanted to work in IISc, Indian Institute of Science, which was then headed by Professor C.V. Raman. And he actually refused admission for her, okay, and only because she was a woman. And therefore, she puts out this statement to say, though Raman was a great scientist, he was very narrow-minded. And the bias against women was so bad at that time. And what can one expect if even a Nobel laureate behaves in such a way? Okay, so it must have not been an easy journey for Dr. Kamala to achieve eventually what she achieved. Okay, so why am I bringing this up here in the context of learning? I want all of you to realize that everyone is human. You may have won the Nobel Prize, you might be the greatest scientist, or if you're a student, you look up to your mentors or your teachers or the clinician whom you see in the clinic. But just because they hold that position, it doesn't mean that they are perfect in every single thing. Okay, so to err is human, and there might be certain quirkiness, idiosyncrasies in some people, and they may not be always right in all the things. Okay, so just keep this in mind, to say that just because somebody is your boss and you think they are perfect, that doesn't mean that all of what they say is always right. Okay, so this is sort of like something we need to keep in mind. And not everything in black and white is true. Okay, so this is more so important for students, and I think you will sort of see this as a recurring theme in one of the video clip that I would show you as well. Whatever you read, either as a journal article or in the textbooks, just because it's printed and it's out there as a published material doesn't necessarily make it true. Okay, so you need to apply your own mind and always look at things with a skepticism and to see whether this is right or not. So when you're a student and you're learning something, okay, and you think that, okay, that contradicts to what I heard somebody else say or what I saw in the clinic, then question that. Okay, and that's the right way of learning, the ethical way of learning. Okay, you need to question, and just because it's in the textbook, because you might see some learning material and there might be things that in one version of the textbook it will be saying something, and then you go look into another reference book and it's different. Okay, so this contradiction would always be following you regardless of whatever you do, whether you're a student, you're practicing. Okay, And as I said, there would be a video clip that talks about it as well. Also, especially for optometrists, I think in this field of optometry, make sure you're learning from an ethical institute. And I put this out because once in a while I run across these situations where there is a student, bright, brilliant, somehow they get into an institute, and then eventually, they find out that they don't have proper teaching resources in the institute, or maybe certain things that they do is not ethical. Okay. Now, almost close to 30 years back when I joined optometry, there was no Google. But for those students who are here, okay, who are, I don't know at which stage of your student life you are in, but there is so much from Google that you can understand about your own institute, or the place that you chose to go do your internship, or the place that you go choose to do your, you want to join that place and work. Make sure that you're actually working for an institute that's ethical and is doing the right thing. Okay. So as I said, till you're in your 12th grade, till schooling, okay, you may not have had a choice because your parents made those decisions. But once you become sort of like an adult, okay, you're into the college and then you're getting out of the college, you need to actually make these right ethical decisions of deciding where is it that you want to work, what is it that you want to do in the work. Okay, so these are things that are very much under your control, and sort of you have to keep remembering this as you meet people, and in this profession of optometry especially, because there are several things that I know is like so alluring. So for example, I'll give you an example. So I had a student with me, and he was doing very well. He started publishing and all of that, and he got an offer, and he had done his bachelor's, and I think he had also finished his master's. So at some point in time, he got a call from a college in Kolkata, and they said, we will offer you the post of a principal. Do you want to come and join? And then he felt that he was very inadequate, even though he could have grabbed that opportunity, and he could have easily at a very young age could have become a principal for an optometry college. He decided to against it. He said that, what, I want to pursue my PhD. I'll have to make sure that I understand everything there is to understand in this field. Okay, and only when I feel I'm ready, I think I'll do it. I think it's too premature, and this offer shouldn't even have come to me. So that was that person's decision, and this person is, of course, now pursuing his PhD abroad in the US. Okay, so I'm just saying that sometimes there are opportunities, but you'll have to make the right decision on how you use or wait on those opportunities. I want to actually show a couple of videos here, and I hope you can hear the audio for this. So what you're seeing here is a child, and this child is sitting in front of a laptop. He is, of course, wearing spectacles, and this language that is spoken in this is like my native language, Tamil, but I'll translate it for people. Okay, so just watch this video. This was, by the way, shot about 12 years back or so, and this video was shot in India, in Chennai.
Okay. என்ன பண்றீங்க? இது விளையாண்டா மூளை வளருமா? எப்படி? அப்படியா? அதுல யோசிக்கிறதுக்கு என்ன இருக்கு?
Okay, so it's actually me who's talking to this child. Okay, and you can see that the child was playing the video game, and of course he's enjoying playing the video game. And at one point I asked him in Tamil, if you play this game, would your brain grow? Okay, that's the question I'm asking him, and he says yes. And I say, how will it help your brain grow? And then he says, because you have to think and play this game. Okay, so that's why he's making that.
அதுல யோசிக்கிறதுக்கு என்ன இருக்கு?
Okay, so he taps on his temple, and so he's thinking, because he said you have to think. And then I said, what is there to think in this game? And he says, he's like thinking, and he says there is an idea. And I don't know, he wants to murder somebody, I think, in that video game. I'm not sure. Okay, so this child is about or was about 4 or 5 years when this video was shot, and this was in India. And here is another video of another child. He is also playing a video game, and this kid, he is like 1.5 years older than him, but near about the same time, okay, when the video was shot. So this was also about 10-12 years back. And he lives in the US. Okay, so he is in Missouri, and we'll watch what he is doing.
How do you know?
It's 25 minutes, and this is the game.
என்ன கேம் இது?
Monster truck. Sorry for the sound.
What's happening?
I'm going speeding up.
Whoa, whoa, whoa.
And I put a fire. And I would. Now it's the next.
என்ன excellent என்ன?
Excellent done. Continue. Going on the next one. Over the hill.
இது விளையாண்டா என்ன ஆகும்? Why is it useful?
I lost. I have to start all over. Over the hills where I left.
But why do you play this game? What is the benefit?
Because it's fun.
இது விளையாண்டா மூளை வளருமா?
What's that mean?
Will it help your brain grow?
No. It just tells you how to learn to play monster trucks. The fun of the monster truck. It tells you the fun of the monster truck.
That is all?
Yeah.
You don't learn any new skills?
Yeah, I can learn new skills.
What, like what?
Like speeding up. There's only 4 skills. Speed up, right, roll left, and brake. So, this is new.
Okay, so I hope you heard what the child said. When I asked him, will playing this help your brain grow? And he says no. Okay, unlike his cousin who was in India, who says yes. And then I asked him, okay, aren't you learning any new skills? And he says, no, you can learn new skills. And what are those? And he is very, very specific to say what it is. It's speeding up. He says there are only 4 skills you can learn. And I believe those are the buttons in that game. Okay. So these 2 kids are related to each other. They are cousins. They both are my brother's children. Like my elder brother's son is this, and my other elder brother's son is this. This guy is the older guy. Okay, this is how they look now. And of course, I've taken informed consent from them to use this video for the purposes of this seminar. But the point I'm trying to make here is, one of them sees the big picture. Okay, it's not about what is the right answer or wrong answer here. It's more about what's the thought process and how does our schools and education system teach us. I think at least in the US, in the way this kid is molded, he is very specific to what can be obtained through that game. Okay, now this kid in India, he is not wrong either. Right? He says that it helps you to think, and maybe that helps in your brain grow. But that's the big picture. Okay. But I feel like when it comes down to learning or writing a paper, it's important to know what is the big picture. Why are we doing optometry? Okay. What's the purpose of this? But then once you know the big picture, it's also equally important that we get into the specifics of it. And only when we get into the specifics of it can we learn anything in detail. Okay, so you need to get to the specifics of it. You need to go into depth of what you're learning. So I just pulled out an example only because I was, working on something on a book chapter, and I thought, okay, here is an example to say, how do we get to the depth of how we learn, right? So the first question is, what is this image that I have put? And of course, I'm sure most of you will identify this as the diachrome. So what is this? It's the diachrome. When would you use this test? Okay, we would use it as the endpoint of subjective refraction. And why would you use it? Okay, why would we use it? Because we want to make sure that we have not overcorrected or undercorrected a person's hyperopia or a myopia. We want to make sure that their correction is optimal enough. Okay, then how will this test work? Okay, this is the specific of how we are going to learn something, right? How will the test work? It works through the principle of chromatic aberration. What is that? Now I can apply the same set of questions and it will come down to the fact that, red has a longer wavelength and it falls behind, green has a shorter wavelength, it falls in front. Why should this wavelength difference be there? Because it will get into the mathematical equation of frequency mu equals c by lambda. Lambda is your wavelength, mu the frequency, and c is your constant for the velocity of light, 3 into 10 to the power 8 meters per second. So it gets you eventually to a mathematical number. Okay. Anything that you do, if you're going to sort of go in depth, you eventually will end up in math. Okay. So I love this saying that says the book of nature is written in the language of mathematics. Now, those of you who have heard me while teaching would know that I always say that the closest to nature that you can understand anything is mathematics. Okay. So math is much closer to the truth. Your applied mathematics is physics. Your applied physics is chemistry. Your applied chemistry is biology. Your applied biology is physiology. Your applied physiology is medicine. Okay, so that is medicine, that is math. I always tell optometry students, don't run away from mathematics. Okay, it'll always catch you up. Regardless of what you do, math is always going to catch up. So the point I'm making here is when you learn, okay, the ethics of you learning anything is to make sure that you go into the depth and be very specific on what is it that you're learning. And then when you write your answers in exams, be very specific and answer to the question that is asked. So from learning, we transition to ethics in the clinics. Okay. Now, if for the medical students, they take the Hippocratic Oath that says, first do no harm. So when a patient comes to you, they are already having a problem. And then when they come to you, the first, your intervention shouldn't harm them even further. Okay. So that's very important that you keep in mind that first do no harm. Okay. Now, the thing is, when we all join as interns, we are picking up skills and all of that, we are not confident. But as we do this, as we practice well, we become good at it. Our patients give us the appreciation. Our students like us. And then there is an ego boost to this. Okay, so eventually we'll stop seeing ourselves for who we are, but then we think we are bigger. Okay, and this problem is there quite a lot in healthcare profession. Okay, medical doctors, and I say that's the medical arrogance. People at some point start thinking that they're God only because patients are worshipping you. Now, the problem is if you look at every other field, okay, and any other, say like a business sort of a setting, your consumers, your clients actually pay money and then they demand and expect more. Hospital is one place where the patient pays the money and then they sort of worship and give so much of flattery to the doctor and are very grateful, very thankful. Okay, this is what keeps that profession running, so they are able to work 24/7, emergency duty, no cribs, no complaint, because they are always in this happy hormone state, because everybody, they feel very valued. So the profession is very valued. But the flip side to it is it shouldn't get to your head. Okay, you shouldn't have an inflated ego problem. I'm going to play this video.
The people that inspire me more.
It's called Killing for Profit. Okay, and I'll not play the full clip, but I just want you to listen carefully to this.
More than anybody else are my own patients, and I'm always learning from them. And I think the day we stop learning as doctors is the day we stop actually becoming proper doctors. So I think that we need to approach a lot of this, there's a lot of evolving science, but we need to constantly have an open mind. The man who's considered the father of the evidence-based medicine movement, Professor David Sackett, said, half of what you learn in medical school will show to be either dead wrong or out of date within 5 years of your graduation. The trouble is nobody can tell you which half. The most important thing to learn It's how to learn on your own. Sadly, I've been a qualified doctor now for almost 17 years. I have slowly and reluctantly come.
The most important thing for you to learn is to know how to learn, okay? And optometry is such a field that it's actually, at least in the US, people should have done an undergraduate degree and then it becomes a professional course. But unfortunately, after 12th, they just get directly into optometry in countries like India, at least. So many of the students are sort of lost, okay? But then eventually they should end up learning on their own. Once you get into clinics, and I don't know if you heard him say, he said, my patients are my biggest teachers. You always learn from your patients, and that's very important, okay? In this video, he talks about the unethical practice of how research sometimes is misreported, the profit of the pharma companies, how they manipulate research and all that. And he goes on to say that, clinicians have no idea of how to read research papers, and therefore they are very misinformed. And the media can be biased, okay? So while we say that you'll have to learn things on your own, it is also important to know you need to exactly know how to find the right resource, because yes, there is Google God, there is Wikipedia pages, but then you really have to be able to extract the truth from all the noise that is around it, okay? And remember, we are in a practice, okay? I don't know if some of you might know Dr. Kathy Stern. She's a behavioral optometrist in the US. One time when she was in our institute, she gave a talk and she said, medicine is practice, like people practice. We say, like, where is your practice? Where do you practice? I have a private practice. So she says we never really achieve perfection. We are only practicing. And apparently somebody joked saying, you're only practicing, when will you get it perfect? Okay, so we never get perfect. So this is a perspective to keep in mind, that it's always a learning process. So even if you finish college, don't think you're done with studies, because you're never done. You always practice, right? So I just said prescribing for profit because the video said killing for profit. And I just put out an ethical question here to say that, regardless of which practice you are in, sometimes there are questions that could be very tightly linked to monetary benefits. So do you want to truly change somebody's spectacle prescription when there isn't a big change there? Are you pushing for contact lens only because, making money is the motive there? So these are things in our profession that becomes our ethical questions of how we practice this, right? And everybody thinks, oh, I'm a clinician, I'm a researcher, I'm an academician. But honestly, all of these things go together. I always say that I think I'm a good clinician only because I'm a researcher. And I think I'm a good researcher because I'm also in the clinic. Because that is what feeds me into the research questions I ask. And the research questions I ask also, I want to translate it into a solution for my patients. So I think regardless of whether you want to do PhD and pursue research, or whether you want to only be in clinics and only see patients, regardless of which way you're doing this in your own life, you have an obligation to learn both sides, okay? So patients would come, even if you're not doing the research, the patient would do the research. They would do the Google search and they'll come and ask you for it. So you are obligated to do that research in order to be a good clinician. And that's important. The other things in the ethics of clinics is accepting a mistake. When I was a student, there wasn't any course that actually taught me how to accept a mistake, okay? And when I was doing my master's and PhD at Ohio State University, and I was TAing, meaning I was a teaching assistant for a course on optometric gerontology. And in that course, the professor taught the students how to accept a mistake. So if you have done a mistake, okay, like you have punched up the cornea when you're doing the intraocular pressure, what do you do? What do you tell the patient? What do you tell your senior, okay, who's supervising you? How do you accept this mistake? Honestly, I wish I knew somebody told me this, because when I was an intern, I actually made a mistake. And the mistake was, we had this 80-year-old gentleman who was referred for Humphrey visual fields. Now, I was in the diagnostic area. I was punching in all the patient information into the Humphrey machine, putting people in Humphrey, setting one patient after another. So I'm just doing things mechanically. So this person's date of birth, for whatever reason, I think the patient said 1918, but it was written as 1980. And so his original age should have been 80, but it for whatever reason, because the date of birth was wrongly written, it ended up that he was like an 8-year-old, or in the time when I was doing my internship. Okay, it was like an 8-year or a teenage age or something. Now, I wasn't even thinking when I'm punching in the numbers from this record that is actually wrongly written that his date of birth was even younger than mine, right? So I have become so mechanical in just running patients after patients. So I just set him up and then I put him there. I put the other patients. Then I go around making sure they don't sleep. They're pressing their push button properly when they're doing the test. So at some point in time, suddenly I woke up, my brain woke up, and then I'm like looking at his date of birth and I'm thinking, wait a minute, what's wrong? And then I actually realized that the date of birth is wrong. And honestly, it was not like I made the mistake, because the secretary who entered the date of birth entered it by mistake and I just copied that mistake, but I wasn't thinking, right? So I could have had a choice of stopping the test and restarting it all over again, which I didn't do, because I actually, when he finished one eye and I started him on the other eye, is when I saw, and there were patients waiting. And then I didn't even go, and I thought like, okay, I just saw his previous Humphrey field. It was already, he was a glaucoma patient and he was already constricted enough. And I thought this field was matching that field, so it's okay. I thought, okay, it's not going to be a big issue. So I didn't even have the courage to go and tell the ophthalmologist who was going to see him with the field report that, I made a mistake. I did not own up the mistake. I was very frightened because I know that person will scold me. In general, everyone is afraid of that ophthalmologist. So I didn't own up at all. But after I was TAing for this course, I thought like, I wish somebody had told me that it's absolutely the right thing to do, that you go and own up the mistake. After many years, I actually looked up on an article in order to find out whether the mistake I made at that time would have impacted what the result of the patient is. And thankfully, what I found was, as your age increases, okay, so here is a 24-2, as your age increases, your visual fields in the central doesn't change. Okay, but as your age increases, your visual field in the periphery does change. Okay, so these are all normal subjects. They don't have any glaucoma. But you can see that as a result of their aging itself, that their peripheral field appears to constrict. So this was a solace for me, because the mistake I made, it was indeed a mistake, but then I don't think it really mattered for that patient's visual fields, because I was only running a 24-2. So whether he was in his 20 or whether he was 80, he still would have had a reliable response. Okay, so the population data wouldn't have matched here much. So that was a solace for me. But being honest also builds trust with your patient. So I once had a patient, and this was a very recent incident. So this was a 23-year-old male. He had a road traffic accident, multiple surgeries in his body. And he ended up with strabismus. He had balance issue. He was incoherent. His sort of like, cognition also had come down, and he had double vision. So this patient had come to me and I had given him a PRISM prescription. And the patient was out of state. So they're not from Telangana, where the state where I practice, but they were from Maharashtra. So I gave the PRISM trial. He walked in the clinic, all fine. Then I prescribed, they went, and then they called up and they said, he still is having the double. When he tried it in your clinic, it was better. But then, at home, he's not very happy with the new spectacles. So they got the new spectacles shipped from our institute. So I said, okay, give it about a week time and see whether he can adapt. And if not, you come back. Okay, so they came back. And then what I found out was, okay, the PRISM prescription that I had written, actually that base was not correct. Okay, so your oblique prescribing PRISM obliques is very tricky. Okay, if it is horizontal, if it's vertical, it's easy. When you compound, okay, you get a direction, you get an angle at which you're supposed to orient the PRISM. So the mistake that I made was, this patient actually had more of the vertical. So when you compound and resolve the angle to which you want to orient it, you get an angle, but you'll have to make a decision on whether that angle should be subtracted like 180 minus or should it go 90 minus, depending on which foria is greater. Okay, so I made that mistake. And when I found out that it's my mistake, I actually told the patient, you know what, because they first thought the opticians were wrong in making that PRISM specs. Then I told them, no, the opticians have done it right. I made the mistake. I gave the wrong prescription. And I said, I'll own up my mistake and I'll replace your spectacles. But our opticals was nice enough and they actually replaced the spectacles and they did not charge me even though I was willing to pay. But what this did was the patient actually trusted me more. Okay. So they went back, they were happy and the patient was doing well. His balance issue, in fact, became better when his diplopia was almost reduced. At a later time, they called me again, okay, and I thought, okay, maybe they're again having a problem with the Prism prescription, but they called me to say, do you know of a dentist over there in Telangana? Because somebody who is trustworthy, okay. And of course, I did not know any dentist. But what I'm trying to say here is when you are honest, okay, either with your senior who's supervising you, with the consultant, or with your patient, I think it builds trust. Okay, and people start trusting you more. Okay, and that's a good thing. And therefore, it's ethical to own up to our mistakes. And I tie clinics and teaching. And like in the earlier video that you saw that said that you learn from your patients, right? So if there is something that you don't know, then you say you don't know. And it's okay to say, I don't know to your patient and also to your students if you don't know what they're asking and you don't have the answer to it. Okay. Now, in India, at least, we have this practice of not saying, I don't know. It's considered as a stigma. Okay. So, and also in medical practice, when a patient asks, there is always has to be an answer. Okay. Nobody ever says, I don't know to a patient, very rare. But one thing that helps me to say I don't know is because I also do research. And in research, you do research because you don't know what the answer is, and therefore you do the research, okay? So when I was postdocing in Boston, I once had a patient who had Charles Bonnet syndrome. And so I'm the optometrist, I'm running this study and I'm writing the history. And the patient said, I have Charles Bonnet syndrome. And I didn't even know how to spell that word. So I asked that patient, how do you spell it? And he spelled it out for me. Then I asked him, what is this condition? And then he said, oh, this is the condition where if your vision is impaired, okay, you lose your vision at a later stage in life, then your brain actually sort of becomes active because it's not getting the input from the visual system. And therefore, it will now make up its own image. It will begin to hallucinate. Okay, so you will start seeing hallucinations in this condition. So this was very fascinating. And I learned more about it. And then I realized that later on, when I went to the American Academy of Optometry conference, there were posters on this. Okay, and the same conference I had actually attended. But then since I didn't know what the condition is, I just walked through these posters. So when I searched and I found out that there was a presentation in American Academy of Optometry conference, I had attended the conference, but I had not paid attention to it. But when I searched and I realized, oh, it is there out there, and I could see quite a lot of literature. So when I taught this in my course as a part of low vision for my students, the students came and asked me the question, what's the prevalence for this condition in India? And I did not know the answer. And I said, and they wanted to actually do it as their third year project. And so Gayatri and Gunashri, who are listed here, it was their third year project. And we said, okay, let's find out what about this condition in India. So we did this study. And we found that it was about close to 8% prevalence in a tertiary eye care center. We got that paper published. We had another paper at a community level, but this was not necessarily Charles Bonnet syndrome itself, but it was just on the prevalence of visual hallucination, and that was about 14%. Within that 14%, some of them might actually be suffering from Charles Bonnet syndrome. Now, the purpose of this talk is not to get into details of these syndromes, but it is essentially to say that when you say, I don't know, okay, you can either learn it from your patient or, with your student, we can discover more. And it's not a bad thing to say, I don't know. It was through this, I don't know, I found out about another condition called as visual snow syndrome. So this is a condition where the patient would actually see some annoying flickering dots or like a salt and pepper appearance in their field. They might actually have everything normal. They might in fact have hyper acuity. They might be 6/4 or 20/13 sort of a visual acuity, but they have a very disturbing sort of like visual perception. So they might have after images, trailing, difficulty in night vision, palinopsia, which is like, trail of images. This is a diagram that one of my patients drew it for me. Okay, because I told her, I really appreciate how vivid you are in describing your condition. So the next time when she came, she made images for me and she said, this is how I perceive. And I told her that I will use this in a publication. And this article is actually accepted and it should be coming out in the journal pretty soon. So we always learn. Okay, it's a never-ending process, and we are now switching gear from clinics and teaching into the teaching itself. Now, this is a quick one. Okay, with optometry, I think things are very tricky because there are several colleges, at least 200 plus in India. Do we have well-trained faculty who are teaching these students? And with the rules of, having a necessity for a PG degree to teach undergrad students, there is a mad race for people to wanting to get masters and PhD only for namesake degrees. I think in the way I've interacted with some people who aspire to do PhD, I think they do it for the wrong reasons. Okay. And when we teach, are we actually updating our teaching material? So as teachers, the ethics for us when we teach is to make sure that, that we don't deliver the same content. At least in the US, faculty would attend conferences and they would learn what is the updated information that they learn through these conferences. And even if they are not pursuing research, they would still go and teach the students on what is new in their curriculum. Now, I think that's an important obligation we have as teachers to our students. I like Robert Frost saying education is the ability to listen to almost anything without losing your temper or your self-confidence. Sometimes there are very seasoned teachers. Okay, they are like sort of like, they have been teaching for quite many years, and so they think they have it all. And then when somebody comes with new information and challenges them, and sometimes it appears like they might feel like, they don't have that self-confidence, or they might be losing their temper. So this piece of advice, I think I take it as a teacher, because if somebody is going to challenge me in what I'm teaching, I think our education should have taught us not to lose the temper or lose the self-confidence, but just sort of like, move away from the comfort zone. Okay, so you learned something 30 years back. I can't be living in the same comfort zone. I need to come out of it. Okay, yes, there is a fear zone because, there is like scleral contact. I've never done scleral contact lenses. Okay, but now that's the new thing. At least I should know some bare minimum to be able to talk with a patient who has binocular vision problems, and she's also wearing scleral contact lens. Okay, so we can never be very static within our zone. We also have to keep ourselves updated. So that's the ethics of a teacher, that we have to not fear. And there are things that I actually want to learn. Okay, so I want to learn the R statistics, and I haven't really moved out of my comfort zone of SPSS because I got so used to it. But I sometimes think I need to challenge myself, and it's only through those challenges that we can actually attain the growth. The final is the research that I want to touch upon, and I'm also making sure that I give enough time for some questions and discussions. So ethics in research is well documented, unlike the other three topics that I said. Okay, it has to start from the history. And why do we have to learn history? Because if you don't learn the history, then we are doomed to repeat it. When it comes to ethics in research, we have to touch upon the ugly history of World War II in the 1940s and the Nuremberg Code, and how it ended up with the Declaration of Helsinki. I'm sure many of you who have worked on research projects or who are trying to publish would have come across this terminology of Declaration of Helsinki. Okay, we write it all the time in our papers, but do we really know how it all evolved? So the World War II in 1940s, okay, the Hitler's Nazi crimes, okay, was unspeakable crimes. Okay, they have done the worst that can be done on humanity. And these were medical doctors who were doing research on these prisoners, okay? And they thought that, these prisoners will anyway die, might as well do some experiments on them and understand. So in here is a prisoner who's experimented on what's the altitudinal effect, what will happen when you depressurize and pressurize somebody in a cabin, okay? And they wanted to do this study because they wanted to see how much of an altitude can their own German fighter pilots could go without having an effect on their health. So the way they would do it is like they put them in this pressurized cabin. They'll see how they are like getting breathless, fainting. And so this guy has participated and fainted in an experiment. And then they'll see what's the minimum oxygen they will need. They will let them die, and then they will study their brain to see what's the effect of it. So unspeakable crimes. And if you think this was happening in prisoners who are vulnerable population, and it never happened in and it happens only in war, that's not the only example. So here is the infamous Tuskegee syphilis trial that started in 1930s and went for almost 40 years, till into 1972. So these were white American doctors, and they had these black African men who had syphilis, and they were actually running a medical experiment, and they wanted to see the natural course of the disease for syphilis. Okay, and so these people did not know they had syphilis. The people who was doing the research did not tell them. They just said that they were getting treated for bad blood. And these people were, they did not know they were participants in a research study even. Okay, so these guys in 1940s, they found out that penicillin was effective against syphilis. So even knowing that medical information, these doctors did not treat them. This ended up in several men dying, infecting their wives, and babies being born with congenital syphilis. So horrific crimes have been done in the name of research. Now, if you think that, oh, it's the African men and maybe, it's a racial discrimination, that's not the case. So in 1930s, there was this another infamous experiment called Little Albert. What they did on this baby was, so this baby, they showed all furry animals like mouse and cat and dog, rabbit, and all that. And the baby was normal. They didn't really react to it. It had a neutral response to this. Then these were psychologists who were trying to understand the conditional behavior of a human mind. And so first they exposed to these neutral stimuli, then they would expose a lab rat. And when the baby is about to touch the rat, they would play this shirking, annoying noise. And then the baby starts crying. So they were instilling fear in this baby by playing this annoying noise every time the baby was about to touch a rat. And eventually, when they didn't play the noise, this baby started to cry every time it saw that lab rat. And eventually it started to cry every time it saw a furry animal. So you would have heard of the Pavlov's conditioning experiment, in which he rings a bell and the dog will salivate. So they wanted to replicate on that on a human baby, on an 11-month-old baby. And this was, of course, 1920s or 30s, and there weren't no real code of conduct of doing research. Okay, so all of these misconducts led to the Nuremberg Code came out of World War II, but then from there on, it evolved into getting into Declaration of Helsinki, and there is now much more refined rules for how you do research. And the Declaration of Helsinki, the most important thing it stresses is informed consent. And University of Oxford defines informed consent as the founding principle of research ethics. And its intent is that human participants have the freedom to choose whether they want to enter research, knowing fully well what it means to take part. Okay, and they need to give that consent before they enter the research. So informed, that word is important, and consent is important. So informed, I'm emphasizing here because sometimes when we are in the clinic and patients think that you're just doing a normal clinical procedure, but you might actually be collecting data for an experiment. If that is the case, even if it is your normal clinical procedure that you're doing, you need to inform the person to say that I'm doing this as a part of a study. I'm not doing anything different from what I will do in my routine clinic, but are you willing to be a part of the study? Only if they say yes, and they give their written consent for it, which they should sign, only then can you use their data. Otherwise, you cannot take it from the medical record. Okay, this is for prospective studies. Of course, retrospective study, there still has to be a place in that medical record that says that the patients are willing to give permission for their data to be used, provided it is anonymized. Again, I'm just touching upon ethics here, but the talk here is not to get into the details of it, but your informed consent should not be coerced. You cannot, twist somebody's arm to get into that, to get that informed consent. The other ethical question in research, and I think this is important for students also to know, is plagiarism. Plagiarism is an act of fraud. It involves stealing someone else's idea and lying about it afterward as if it is your own idea. This is not my statement. I took it from this source. And because it is not my statement, I put it in double quotes. So if you ever write a sentence from a book as a part of your own thesis or dissertation or a project report, or in your journal article. And if you're going to exactly take the same thing, you'll have to paraphrase it within quotes. Otherwise, you'll have to write it in your own words. And if you do not, then that will be called plagiarism. And there have been enough of examples of plagiarism, misfraudulent reporting, data manipulation. In one of the famous, or I should say sad, outcome of this is a very famous Japanese scientist committed suicide, Professor Yoshiki Sasaki. Now, he published in Lancet and Nature and all of that, and then he had to retract the paper. And it was not actually directly his mistake. A student had done a data manipulation, but he took it so much on himself, saying that, as a senior researcher, I should have been responsible for it. And it went to the sad ending that he committed a suicide because of the shame. It has taken people's lives, and it can take other people's lives. So this guy here is an American doctor and a superb achiever. Okay, he finished his medical school, he finished his college graduation in 19, was already a famous doctor by age of 27. So he was on a super high track of getting into fame. But that craving for the fame led him to sort of do data manipulation with big data. And this sadly happened during the COVID episode. Okay. And because of his fraudulent data that got published, people stopped certain clinical trial thinking that the hydrochloroquine, the malarial drug, won't be useful. Okay. And only later people found that, his article was wrong, and that was published in Lancet, and he collaborated with Harvard professors to publish the paper, and then they had to retract, and that stopped and cost so much money. Okay, so plagiarism, unethical practice in research can lead people to take their own life, or it can lead to other people dying because of your unethical practice. So it's very important to keep all these ethics, whether be it learning clinics or teaching and research. I like this quote. It says the difference between school and life is, in school you're taught a lesson and then given a test. And in life you're given a test that teaches you lesson. Okay. So I learned some lessons in my life through my mistakes, and I've shared that with you here. Okay. And only a fool learns from his own mistakes. And I think I will correct that as the wise human learns from the mistakes of others. So I just urge all the students and whoever else is listening to it to be wise and learn from my mistakes and from the others' mistakes that you see around. Okay, you really don't want to be making all these mistakes yourself to learn. So with that, I'll thank you, and I hope there is enough time for questions. I know it's late in Malaysia, so over to you, Fakhruddin.
Yeah, thank you, ma'am, for that talk. And probably it has hit most of the nerves when we, hear the talk. And it's really important for us to take a lot of point into consideration. So thank you so much for putting all of this together into one hour of that session. Thank you so much for doing that. I think the first question is up there. It says that if something is wrong, when do you think to forgive people, and when do you think to take any action? Any thoughts over that?
Forgive is a big word, no? So first of all, we'll have to see whether we are ethical enough and perfect enough to sort of punish. But okay, so if I'm a teacher, right, and if I'm in the position of having caught somebody, and I have been in that position, okay, so I once had this student who was doing it's a fellow in our institute, and so they saw this patient, and this patient is a very hard patient. She is very photophobic, wouldn't cooperate for most tests, wouldn't open her eyes and all that. And so I was about to the fellow was supposed to do all the slit lamp and all of that, and I was about to dilate. And then before I dilate, and this patient has been coming to us for a long time. So I said, okay, all of your test is done, your pressure is done, so I'm going to dilate. I'm telling this to the patient. I usually tell patients, I'm putting a dilation drops, we are going to see the inside of your eye and all of that. So then when she said, no, my pressure is not done, and I'm seeing the record, and that is a pressure recorded, okay. Then I asked her, are you sure? And she said, no, pressure was not taken. And I trust the patient because she has come many a times and she knows the procedures. So then I called the fellow out and I said, did you do the IOP? And the fellow said, I did not. Then I said, how can you just, and they had copied the previous IOP value. And that's a very bad mistake, because what if the patient truly had a high IOP? If you haven't done, you just say you are not able to record, right? So I honestly, that mistake could have gotten her thrown out of the program. Okay. And I was saying that, this is like very serious thing. I'm going to get you thrown out and all of that. But then I didn't end up complaining. But then I said, I'm giving you the last opportunity. I never ever want to see you do this sort of an unethical practice ever. I think that's stuck in that person for a long time. And eventually when they finished fellowship and then they came back and they thanked me for giving that opportunity. Okay. When do you choose to let go and when do you choose to not, like really chuck a person out? Depends on the attitude of the person. Okay. If you know that they are very sincere to learn from the mistake, they realize their mistake, then you give them a chance. But if they have that attitude of it's not going to work out and they are not even realizing their mistake, please don't have them in the system, because they're going to harm a lot more patients. So that's right. How I'll make a decision. And of course, this decision is just not me. There will be a committee. If it is going to be like you have to throw somebody out of the program, it's not one person decision. There is a committee that will go through it. There is a formal process.
Right. And there's another question on confidentiality. So in terms of clinical practice, any takes on in what circumstances one can look at this confidentiality? I think it is also very related to being ethical and making sure the details of patients are not being leaked, something like that, on those thoughts.
Yeah, so this confidentiality is like, I'm not sure in which context the person is asking this question, right? So is it in research? Because in research, it's always anonymous. You can never publish anybody. Even if I'm going to show the site profile of a patient and the patient themselves cannot recognize their own photo, I still have to take a consent and we'll have to make sure that their identity is not revealed, depending on the condition that you're trying to show a picture for. So confidentiality, I think with research, it is absolutely important that you keep everything confidential. You can't tell this person participated, share their medical history with somebody else, that sort of confidentiality. In the clinical setup, sometimes we get patients like, we once had a patient, they were newly married couple and the girl had RP, okay, retinitis pigmentosa. But then the complaint was, only for the past 2 days, I'm having this issue. And the husband is like, what happened to her? It's past, they've been married for 1 month, 2 months or whatever. And now this is not 2 days. Okay. This must be a past history, but then how do you handle that delicate a situation? Okay. So you will say that, okay, I'm doing a test and you take the wife out separately, then you ask a separate history. And then they don't want this to be revealed to their husband. So that's a confidentiality with the patient, an adult patient with whom you need to maintain. What do you tell the husband? What do you tell the wife? How do you manage? So these are sometimes very ethical questions, very tricky questions. And you'll have to know what is the right thing to do. You can never give somebody, this is how you should deal with, because it's always a gray zone. That's how life works. Right. So I don't know if I answered the person's question in the context in which they asked.
Sure. We'll let, if you have any more discussion, I think you can put it up on the chat. But just moving to the next one, this is more of a communication related question. Anytime have you encountered talking probably in a bit harsh way to a patient? Would that be something, when it comes to non-cooperating patients or something like that?
Okay, I can give you few examples, okay, and I like this example because this person was a judge, okay, he was a judge, and he came from Northeast India, okay, and very, very busy guy, very busy in his practice, taking phone calls, blah, and all of that. He had a vertical diplopia, he had a double vision, and he stopped driving and he has a driver and he wants to fix the double vision. Now I have to give him a prism trial and it takes time. Okay. And he is like, I can't wait for this. I'll have to come back or whatever. Then I told them, if you don't find time for your health, you will end up finding time for your health. Okay. I don't know how many of you understood what I said. Okay. If you don't find time for your health, you will end up finding time for your health. Okay. So because you will make it so worse that now you can't do anything but to give attention. So the moment I said that, it hit him hard. And then he said, okay, fine, I'll stay back. And then he got it done, and so things takes time, and there are ways in which you can convince a patient. Now, if they are not cooperating for a test, say for example, if they don't cooperate for IOP, that's just the reflexive thing. It's not like they want. See, even though I said that patient who's very hard, because the person is hard because they're photophobic, right? It's not intentionally. I can't be harsh with them. So you just have to ease it out, turn off lights, sort of try to ease them up and deal with them that. And then I've also had patients on whom I had to put my foot down and say, this is it. Because this patient went on asking questions after questions, and I am having other patients waiting. At some point, you'll have to be harsh and you'll have to say, I've answered all your questions, but I can't keep other patients waiting. And so make a decision and move on, sort of. So you should be kind, but then after a point, you know where the limit is. And you need to know how to communicate that without being very abrasive.
That's right. Yeah. And a couple of questions are related to advice on, I am a student and I want to pursue research and things like that. So I'll keep that for a later discussion, probably, unless you want to add on something. But I thought I'll just mention this because there were a couple of questions which students are asking about advice on research, and I'm an intern, what should I do? But probably we'll get you connected on an individual basis, and if there's anything, I think we all can help as a community. I think the optometry fraternity is great and everybody is here to help. Anything you want to add on, Dr. Prem?
No, research. See, I can only, whatever people are going to ask, I can only answer it from the ethics point of view, because that's the prism through which I'm looking today, right? Yeah. So all I can say is, if you're a student, okay, and you're involved in a research, and it involves human subject participation, please make sure that you're informing that this is research. I personally know people will be like, okay, we'll have to do one more test. Let's go do the test. Okay. Oh, you'll have to sign the form. Patients have no idea. They'll just sign a form. They'll do a test. Okay. I have had patients refuse to participate when I say research, and that is totally okay. Okay. And that's totally okay. I do a research with babies, pediatric perimeter. We had quite a few parents refuse. And so we report that in our practice, in our paper. We say that, 30% refused participation. That's totally fine. That's not a shortcoming of you. Okay. Yeah. That is how the procedure is. So don't feel bad if somebody is, refusing to participate, and don't think that, by informing and saying research, people are not going to come and I will not get subjects. Okay. Do the right thing. There will always be right people who will participate in your study. Have faith in the system and in ethics.
That's right. And just, continuing our discussion a little bit on publication. So anything in terms of gifting authorships and any advice on deciding the authorship order in a manuscript? A little bit on these lines, if you would like to add on.
Yeah. That's the bad gift you can ever give, gifting authorship. You never gift. Okay. They might be the senior, blah, whatever. Okay. The easiest way to do this is you go by the ICMJE guidelines. I have had to deal with medical doctors because some of my research is multidisciplinary. I don't want to name any profession, but there is another medical fraternity, a different profession with whom I have to work. And when I first went for collaboration, that person right away told me, I will be the first author and I will be the corresponding author on this research. Okay. Even before knowing what research I'm going to do, I said, I'll be happy to give you the corresponding author and first author, provided you satisfy ICMJE criteria, because this is not my guidelines. This is ICMJE. You should have conceived the research idea. You should have, contributed for this. You should write the paper. You should be able to answer the questions that the reviewer is going to ask. Okay. So if you are able to do this, I'm more than happy. If this is there are several questions in the project that we are going to collaborate and do. So if you pick up any idea, we can do. Again, and this is somebody in a very fairly senior position in that place, right? So when I said that, then they sort of, toned down. And I've had to refuse authorship because one time there was a clinician who told me, but I only made the diagnosis. It is only because of my diagnosis you recruited the patient. And therefore, I should be an author on this paper. Okay, so somebody was fighting with me for the authorship. And all I have to tell them was, even if I don't do this research, as a clinician, you will still write that diagnosis. Okay. As a clinician, that's your duty to write the diagnosis. So that's not going to change anything for the patient or for the research. So there are ways. I think you just pick up ICMJE guidelines, go to them, tell them this is it. If you tick on all of this, you're an author. Okay. The order of authorship depends. This is a practice I got from my postdoctoral training with Professor Eli Pelli at Harvard. Before we start a project, we put a manuscript plan. We will say who is going to do what, okay, and who will contribute to what sections, even before you write the section. So everybody is clear on the page. And depending on how the manuscript evolves, if somebody is going to contribute much more, then few things can change over. Okay, so that is how you decide the authorship. Usually the senior author goes in the end. But if they are the ones who are going to write it a lot, write everything, and it's the student who's just getting a practice, then the senior author has all the right to be the first author and the corresponding author. But if the student has made sincere effort and have written a reasonably decent enough draft, I give the student the first authorship.
Yeah. So it depends a lot on the efforts which an individual has put in very short, and there are guidelines for it. And somebody was asking, what are those guidelines? And we have somebody also.
Guidelines. I'll just type it out in the chat box. So
yes. Somebody has also, Dr. Gopinath, I think, has put up the link as well. Thank you so much. So that you can look at those recommendations. I think that is really clear cut out on looking at who can be on what position in that author list. Because for everybody on that publication list, it is very important, right, to have your name being seen.
Provided you have given fair enough contribution. See, one of the things is this. Some people think, oh, I did all the data collection. I only worked hard. Okay, so students have the tendency to think that I did the data and all of this, and therefore I should have been the first author, whatever. So Eli Pelli was very clear when I worked with him. He said, just because you're running the study and doing the data collection doesn't make you an author. It depends on your intellectual contribution. How much of intellectual, that is what takes the precedence actually in the order of authorship. Who conceived the idea? Who is contributing enough for the discussion? What's the intellectual content you're bringing out new? Yes, the data collection is important. You will get an order in the authorship, but that doesn't take you to the first author.
That's right. Yeah. We'll take a couple of more questions. It's getting a bit interesting in terms of what we are discussing, but just taking two more questions. One of it is with regards to ethics in teaching. Somebody says that it's good to have that institutions as well as business follow a particular ethics law in terms of opening their colleges as well as the institute. Is there any suggestion in terms of raising the awareness amongst the uninformed parents and students of such colleges? Again, any thoughts which you would like to give?
Once when they get into a college, it's very difficult. Okay, then the college is going to come and either fight with you or it could turn ugly. We don't know how powerful these colleges are. But this is why I'm saying that, there is Google now. People should actually basically do some search and find out about places before they go join a college or an institute where they work. How do you raise awareness? Well, honestly, I don't think there is any good answer for this. You can, World Optometry Day, we might hold signpost and stand on the road, shout slogans, and it's our own cohort that will shout. There'll be people walking by. Maybe it might hit one or two people. That's one way of doing it. I think increasingly, there are TV ad commercials that comes up now. And I think Titan or somebody says that, we have qualified optometrists in our practice. I think these are good signs. People are picking it up. I think there is a lot more awareness for optometry than how the many years back when I started. Okay, so hopefully people will do the right thing with better awareness.
Yeah, I think, and we as individuals, practitioners, students also have a role to play. At any point in time, we should be telling about our profession as well as the things.
Absolutely. Sorry for interrupting you, but I'll tell you this. I get children in my clinic, right? Binocular vision clinic. I always have a conversation with them. I ask them, what are you interested in? What are you going to study and all that? Sometimes these kids come 10th grade and 12th and they are crammed. They're writing their entrance exam. I always tell them about optometry, okay? Because when they address me as doctor, I'll say like, I'm an optometrist, and, the ophthalmologist will see you next and all that. So I always make sure I give a career option when I actually interact with children. So that's one way in which you could do it in your clinic.
That's right. Yeah. And I think we keep on saying that associations and all of them will do their work. But I somehow feel that it's also an individual responsibility at any given time.
And we have access to these general public who are coming to us as patients. So increase awareness that way too.
That's right. Okay, we'll take one question. There are a lot of more, but I chose this question. Just a summary that there is a patient who has an information about the treatment, but when we look at the treatment, there are more of testimonials and not much of relative research papers. Any ideas on how would you convince or explain the patient when there is no probably a scientific evidence and just testimonials? Is that ethical, or any thoughts?
I think, Gopi, it's ethical in what you're doing, because you are also searching for testimonials, and more than testimonials, you're actually searching for a scientific evidence, because you don't know who writes the testimonials. You will have certain places, and there are testimonials that people put a picture and say, oh, I went to this place, it's very good, and all of that. I think the evidence in a reputed journal. So that's the other thing, not a predatory journal, but a reputed journal. If there is something out there, it would have gone big. This is a big problem. The stem cell therapy, somebody very young, right, in their working age, when they go blind, is very, very hard. So I think everybody goes through the 5 stages of grievance. There is denial, anger, all of that, and eventually acceptance. The patient is still looking out for treatment is because they still are not able to accept the fact that they will have to choose their alternative ways of living. Okay. So to tell them that, okay, let's just, from habilitation, they need to now go to rehabilitation to redo all their things that they are doing. I think it might help them if they join forums in which there are similar patients, and then they are able to manage life. I think that's where you sort of should nudge this patient, because honestly, I don't think there is any evidence now that says stem cell therapy works. I've heard of horror stories of patients selling their houses, selling off all their property, going to China or somewhere, trying to get a stem cell therapy, and only ending up finding out that they are broke now and blind. Okay, so I think it's our moral and ethical duty that we tell these patients these kinds of things that have happened, and then sort of nudge them into getting into acceptance and moving on. It's not easy, but do we have a choice?
Yeah, so I think informing them is the ideal way, and you can't hold them and say, no, you can't do it, but at least informing them in the correct direction would be at least a starting point, right? Awesome, great. So I think with that, thank you so much, for all the questions, and thank you so much, everyone for joining. Thank you, Dr. PremNandhini, for, doing this session for us, and, I would say it's taking up a challenge, because as we were discussing, you have not done these kind of talks before. You had to kind of do this specially for this audience. So I appreciate your time and efforts, and, thank you for doing that for us.
Well, thank you for the opportunity, and thanks to all the participants for, I thought there wouldn't be very many people on a very offbeat topic, but I'm impressed that people had the interest to join. So thank you.
Thank you so much. We do have a session planned on next weekend. It is more to do with record keeping in optometry in clinical practice. So I invite you to join the session, and so until then, take care, be safe, and I hope to see you in the next session. Bye-bye.
Bye. Thank you.
Thank you, ma'am. Take care. Bye.
Bye.